Yeah.
Something.
Oh, yeah, she should. Oh, yeah, yeah, I saved it, my maybe it was supporting, so.
My game's still there.
Okay, he's coming. Not first. He's coming in. Yeah. I don't know. I know.
He's coming in.
Yeah.
Mary, he's coming in for the meeting?
Yeah, John made him fly it, 'cause that's why he wanted to make sure they were gonna be on the lot.
Yeah.
Well, I guess I don't have much choice.
The special questions together.
Yeah, you really say.
All right,
Yeah, let me leave. Let me loose on him.
All right, we're just gonna start. But I have this vote, I have this stuff though. Okay. And I can. Okay, and I'll just say yes. Yeah, but you can see the vote. Okay, we have one item to vote on, so we can do this. Okay. All right, we are going to call the Committee on Audit to order. If you are listening in on Zoom, we're having some technical. You can hear us, but we will not be able to hear you if anyone needs to speak to us through Zoom. So, Madam Clerk, please call the roll.
Commissioner Wilson, Commissioner Peterson Mayberry.
Oh, she is here, but she just stepped out.
Commissioner Colleen.
Here.
Commissioner Garza.
Here.
Commissioner Knizik. Chair Dobb.
Here.
You have a quorum present.
Thank you. Next item.
B, chairwoman's remarks.
I have none. Next item.
C, approval of the March 11, 2026 meeting minutes.
Okay, is there, okay, can you, yeah, let's just do this. Thank you. There's a motion by Commissioner Garza, supported by Commissioner Wilson. Any discussion on the meeting minutes? Hearing none, please vote on your tablets. And I vote yes.
I vote.
Okay.
There it is.
Motion carried.
Okay, thank you. Next item.
D, unfinished business. Business, there is none listed.
Next item.
Moving to item 1 under new business. Forwarding a copy of the Office of Legislative Auditor General's Performance Audit Report on the Wayne County Department of Juvenile and Youth Services Abuse and Neglect Program.
Okay, great. I will turn this over to our audit team.
Good morning, Commissioners.
Good morning.
We have before you
And can everyone make sure that your microphone is on and introduce yourself and name and title for the record, please.
Bandy Otis, Deputy Auditor General. And we do have guests here today.
Okay, and can the audit team introduce themselves first?
Kristen Presto, Legislative Internal Auditor 3.
Sandra Allen, Legislative Auditor 3.
Okay, thank you. And our guests?
Hi. Portia Carlisle, Juvenile Youth Service Division Director over Community-Based Services.
Good morning, Rachel Davis, Department Director, Juvenile and Youth Services.
Morning, Sharon Rose, Finance Director for Management and Budget.
Yeah.
Yeah, I don't think they're working, but I don't know if the people who are listening online can hear. Right, but they're just not projecting through there. So if you can speak to the back of the room so that I can hear you, because it is far away. So,
Okay.
All right, thank you.
Good morning, Carolyn Nemo, Chief of Operations, JYS.
Good morning, Sam Haddad, IT Administrator, JYS.
Thank you. Welcome, everyone. All right.
Vandy?
Okay, so we had the Department of Juvenile Youth Services report for the abuse and neglect program. The objective, scope, and methodology. Our objective during this engagements were to assess the compliance with major contract provisions, determine whether amounts billed and paid were in compliance with the contract service and rate schedule, and assess the accuracy and timeliness of the billings to the state. The scope of the engagement was performed in accordance to generally accepted government auditing standards. Our engagement scope was from the period of October 23rd through June of 2025. The principal methodology used for this engagement include interviews with key members of management, inquiries, analytical procedures, observations, and a review of program regulations, operations, and documentation. The background. The Wayne County Department of Juvenile and Youth Services is responsible for overseeing the administration and usage of the Child Care Fund grant funding that is used to execute the abuse and neglect program. The Michigan Department of Health and Human Services currently provides grant funding through the Child Care Fund to cover monthly expenditures that are incurred from the abuse and neglect program. The monies are required to be used to cover expenses that are incurred from services such as intensive in-home care, juvenile justice, out-of-home placements, drug screenings, and mental behavioral health interventions. The JYS division currently submits a reimbursement request to the Michigan Department of Health and Human Services to obtain a reimbursement for monthly expenditures. Per the Child Care Fund guidelines, program administrators can only receive a reimbursement of 75% of expenditures that are incurred for in-home care services. The Michigan Department of Health and Human Services must also review and approve each reimbursement request for validity prior to dispersing grant funding to the county. A summary of issues. Based on our audit, we identified 7 issues and made 11 recommendations to strengthen the internal control environment within the abuse and neglect processes. All 7 of these issues are classified as control deficiencies, which are deemed to be low risk. We discussed the 7 issues and 11 recommendations with representatives from the Juvenile Youth Services Division to attain their concurrence and/or disagreement. Management agreed with all 11 recommendations that were discussed within the 7 issues of the report. Now I would like to turn it over to our staff to go more in detail about our findings.
Okay, the first issue is the tracking of certificates of insurance. The Risk Management Division had not established any policies, procedures, or controls to ensure continuous monitoring of insurance coverage throughout the contract period. Also, there is no defined process for tracking certificates of insurance expiration dates, obtaining updated insurance documentation, or verifying that coverage reflects changes resulting from contract amendments. Failure to establish and implement policies, procedures, and controls to ensure continuous monitoring of insurance coverage may result in contractors not having the contractually required insurance coverage, which could ultimately expose the county to liability for claims. So we recommend that the Risk Management Division establish procedures to monitor insurance coverages to ensure compliance with contractual provisions, and develop and maintain a centralized tracking system to monitor certificates of insurance, to track expiration dates, and ensure timely follow-ups for renewals. And management agreed with these recommendations. Okay. So the second issue was non-compliance with contract requirements background checks. Background checks were not always in compliance with contractual requirements. We specifically noted exceptions in the following areas. Background checks were not performed on all subcontractors. Support for background checks was not maintained by JYS. All required background checks were not always performed and/or verified. Background checks were not verified prior to first day of providing services. Contractor employee's name was not listed correctly. Background checks not in compliance with contract provisions. Due to inadequate oversight, there is an increased risk that individuals who have not undergone required criminal background checks may provide services involving face-to-face contact with youth under the contract or have access to confidential youth information. By not monitoring that all background checks were completed prior to an individual providing services under the contract, there's also the risk of undetected loss since JYS management could request repayment for services performed without an adequate background check. We recommend that JYS management strengthen its oversight and monitoring procedures for all service providers to ensure full compliance with contractual background check requirements, such as verify that all required criminal background checks are completed for all contractors, employees, volunteers, and subcontractors who have direct contact with youth and/or have access to confidential youth information prior to the commencement of work or any transition into contractor roles in accordance with the contract and policies and procedures. We also recommend that they document formal policies and procedures surrounding the review of background checks conducted by contractors, including procedures to obtain, review, and retain supporting documentation evidencing the completion and review of required background checks. And management also agreed with these recommendations. And now I will pass it over to Ms. Allen.
Thank you, Kristen. The third finding, policies and procedures do not include critical processes and cross-training not performed. JYS has one individual solely responsible for performing a detailed review of the invoices submitted by the contractor. This individual has been performing this review since the process was implemented and without a backup individual. In addition, the detailed review performed by this individual is not documented in the policies and procedures over contractor payments. Relying on a single individual to perform critical processes could result in the monthly review not being performed timely and accurately in the individual's absence. We recommend management within JYS modify their policies and procedures to include the process for the detailed review of the service provider invoices prior to approval for payment and include cross-training for the key function of billing review process to ensure other staff members are able to perform the function. Management agreed with the recommendations. The next finding, non-systematic sampling in selecting billing review sample. The sample selection approach that the JYS contract administrator currently uses during her billing reviews does not follow a formal random sampling methodology. The selection method is instead non-statistical and is based upon judgment rather than mathematical probabilities. This type of sampling method could also introduce bias if not carefully managed. The absence of a statistically or systematically randomized sampling process increases the risk that errors, unsupported services, or billing discrepancies may not be identified during the review process. We recommend that JYS management consider modifying the current policies and procedures to require the use of a consistent and statistically valid sampling methodology for reviewing service provider invoices, which may ensure that all items under review have an equal chance of selection. Management agreed with the recommendations. And now I will turn the floor over to Ms. Jones.
Hello, all. I'm Erica Jones, Principal Senior Auditor on the engagement. The next recommendation regarded the inadequate monitoring and review of duplicate billings, which is on page 14 and 15 of the audit report. Based upon our review of the JAS system, we noted that 3 of the 50 billings that we sampled were duplicate billings based upon the services that were rendered. We also determined that the aggregate dollar amount of these duplicate billings came to roughly $480. Also, all three of these billing transactions were in fact duplicate billings, and that one of the three had not been approved for billing. By not conducting an adequate review, the county may pay the contractor twice for the same service or for services that were not performed. To enhance the controls within the invoice and billing process for youth service contractors, we recommend JYS management to revise their periodic review process to include a verification of duplicate billing transactions and unapproved billing transactions to ensure that the county is not billed for services that were not rendered or approved. We also recommend that they work with the JAS contractor to determine how unapproved services are included on the monthly invoices and make necessary changes so that unapproved services are not billed. Management agreed with these recommendations. Our next finding was in regards to invoices were included for non-billed transactions, which is on page 15 through 16 of the report. 3 of our sample of 75 billing transactions had not been approved within the JAS system and were still billed. We also saw that these non-approved billing transactions amounted to $1,098. By not verifying whether billing transactions represent a valid service that was authorized and approved, Wayne County may remit invoice payments to contractors for services that were not actually provided and authorized. To enhance the controls over the approval of billing transactions from the contractor, we recommend JYS management to revise their periodic review process to require JYS management and or staff to conduct a verification to ensure that all billing transactions are authorized, completely documented, and only for services performed. We also recommend that they work with the JAS contractor to determine how unapproved services are included on the monthly invoices and make necessary changes so that unapproved services are not billed. Management also agreed with these recommendations. And our last finding was in regards to the untimely processing of reimbursements from the Child Care Fund, which is on page 17 through 18 of the report. Our analysis of the 33-month scoping period of October 22 through June 2025 found that it took the county an average of 50 days to submit the reimbursement request to the state after they paid the contractor. We also found that it took the state an average of 65 days to process the reimbursement request once they received it from the county. JYS management explained that many of these untimely reimbursements were caused by circumstances outside of their control. By not timely submitting the required documentation to the state, JYS management may encounter a delay in receiving reimbursement for invoices already paid to the service provider and rely heavily on the general fund. To enhance the controls over the processing of reimbursements from the state, we recommend JYS management to ensure that the contract manager or the designated staff member conduct a periodic review to ensure that all required documentation is submitted timely to the state to receive reimbursement from the Child Care Fund. Management also agreed with these recommendations. Upon our conclusion, we discussed the issue and corresponding recommendations with representatives from the Juvenile Youth Services Division. Management agreed with all 11 of the recommendations that were listed within the 7 issues. We have included management's responses to the issues and recommendations with the audit report. We are now open for any questions or comments that you may have.
Thank you very much. I'm going to turn it over to our Auditor General real quick, and then we'll go to discussion.
Marcia Carl, Auditor General. I just wanted to add that during the scope of this engagement, the services were provided by Assured Family Services as a contractor. There's since been changes to the program, which is now going to be handled by the state. I think the department can give some more information on that aspect of it. But I wanted to indicate too that the recommendations that are in this report, while they were geared toward the contractor for the abuse and neglect program, these recommendations would be valid for any of the service providers that are providing services for the Child Care Fund or other juvenile services programs. So they're very good recommendations for that point of view. And also I wanted to add too that we, met with the department. They were very open to, and I think they've already started implementation of most of the corrective action on these recommendations.
Okay. And to that point, because this program is completed and Assured Family Services is completed with us, do we want to do a corrective action plan or something that applies to the CMOs?
We had discussions and we thought originally we weren't going to do a corrective action plan, but we think because these recommendations are good recommendations for all the service providers, we could do a corrective action plan and look at some of the invoices of other service providers, which could be the CMO. But I believe most of these recommendations are going to be implemented if they haven't already been implemented. So it'd be a very easy corrective action plan to do.
Okay. All right. I'll first turn over to the department for any discussion or comments on the audit, and then we'll go to commissioner questions.
For Rachel Davis, Department Director for Juvenile and Youth Services. First, I'd like to say thank you to the audit team. They were very easy to work with, and we do appreciate someone coming in to look at best practices so that, we're in line with what needs to be done to make sure that both we're being fiscally responsible and we can make sure that the services that we provide to the youth and families of Wayne County is sufficient. Again, to the Auditor General's point, AFS is no longer a contractor of ours, so that contract has completely ended. Several of the things were already underway. As you all know, I'm new to the Department of Juvenile and Youth Services. So things like the background checks, shoring up our policies, cross-training of our staff, that was something that I started to do, really quickly once I joined the department. So again, we do agree with those points and we are working on those items. As far as, and I can let Finance Director Sharon Rose speak to the section about timeliness with submitting reimbursements to the state. I'll go ahead and let you speak to.
So there is a There is a correction there. Sharon Rose, Finance Director for Management and Budget. We are the department that actually submits the reimbursement. The Third Circuit Court also has a part in that. So once we have done our part and we receive the Third Circuit Court's paperwork, we then submit the reimbursement into the state's MySACWIS system, but our submission is predicated based on when the general ledger closes. We cannot submit anything to the state until the general ledger closes, and as most of you know, it doesn't always close on a timely basis. So it is out of our control, but as soon as that ledger closes, we usually get our billing in within 3 to 5 days.
Thank you. So to that point, although we would like to be able to submit things more timely, all of our work depends on the work of other departments in order to completely close things out. So although we are going to continue to do periodic reviews as suggested, because we think that is a good suggestion, to Director Rose's point, the final entry, is predicated both on the court submitting what they have to submit and the general ledger being, closed so that we can do what we have to do. But if those things don't happen, no matter what JYS does internally, it cannot impact the outcome.
Okay, Commissioner questions, discussion. Commissioner Peterson Mayberry.
Thank you. Thank you, Director, because one of those questions you've already answered. My other question was around, I know there was language around with the background check, Michigan State Sex Offender Registry versus the National Sex Offender Registry. So are we clearing through subcontractors or parent contractors? Are we clearing both of those registries?
That is the intention. I believe that during the audit process, it was found that one or the other was not being done. Again, me coming from a law enforcement, in the background check process. We are internally working to make sure that those things are.
Doing both.
Because
Mhm.
we'd like to make sure that we have, stronger sets of background checks instead of
Mhm.
relying on the iChat and other things. Do something more robust like NCIC and Lean, which will tell you nationally if there is an issue in someone's background.
Absolutely. I was going to mention lean, but I'm glad you did that. And then thanks for being here. I know a lot of times in audit, we ask questions to the audit team and they let us know that that's not kind of what they do. They're going through processes and seeing where there's some gaps and voids. So thank you for being here to answer the questions. My only other question was, what does cross-training look like for the individuals who are going through the billing process for the services? I know you said that you were, because it was identified, only one person knowing how to do it. So what does cross-training look like?
So as part of not only cross-training, but succession planning in the Department of
Mhm.
JYS, we've identified employees that have 25 plus years. And
Mhm.
I want to make sure that our department doesn't suffer because people are ready to retire, to move on. So we are working on cross-training in general and as well as for that billing process.
Mhm.
So we don't want to have any one staff member that can only be in their lane.
Right.
We want them to be able to be cross-functional. I'm having, if this body has noticed, I have invited different members of the Department of JYS team because I want them to be able to know the full process and how the commission, interacts and allows our work to be successful.
Mhm. Great. Thank you. Thank you, Madam Chair.
Anyone else? Commissioner? Yes.
Thank you, Madam Chair. And good morning. I want to do a little history first. Assured Family Services. When did we cut them loose from their contract?
It was around, I would say August 2024 or
2024,
yes.
24.
2024. So as you know, at the time, I was assistant county executive when that transition
Ah.
occurred. But I believe it was as a result of the RFP process. I don't believe that they were successfully awarded an RFP, if I recall correctly. And that's how the transition came about.
So who is performing that function now?
So now,
Did you award a contract?
no, we didn't. I'll let Portia
So
Carlos.
you took this all in-house now.
So it is split between, sorry guys, so it is split between Third Circuit Court. They have a lot of responsibilities that AFS used to do. And then it's also split between an internal department within JYS. It's our assessment and referral services. They do a lot of that work too. So their services has been split between Third Circuit and internal with
So Third
JYS.
Circuit's picking up some of the,
Correct.
okay, I don't know how I missed it. I mean, because that's the old Jack, the old juvenile assessment center that we had forever. And then they changed their name, what, 5-6 years ago to,
Assured Family
and
Services.
did they have subcontractors under them, under the contract? Did the AFS, whatever, Family Services? Did they have subcontractors under their contract?
So, yeah,
So we don't have any of those anymore.
no, because we no longer contract with AFS for their subcontractors.
Okay, and who has the juvenile accountability information system? Who has that? That's always been ours in the county? Okay. All right, just trying to follow the, so have you brought on new people in order to perform these?
Yes.
Okay. And is all that paid for by the yeah, the child care fund. With which, just to be clear, we match that 25% to pull down the other 75%. Is that how it's working now?
That's on the prevention side. Yes, it's
Say
25.
again?
On the prevention side, yes, it's 25-75. For institutional, it's 50-50.
This is the preventional
Correct.
side?
Correct.
Yeah, that's what I thought. And those are county general fund dollars that are sent up to match
Yes.
with the child care fund.
Yes.
Hence, we have to have the general ledger done or whatever in order to spend that money. Because I look at this too, and from the chair I sit in, I'm thinking, liability, right? if services aren't provided properly, you have families out there that are like, okay. All right, so with regards to the comments that the Auditor General made, that these recommendations would be good for other contracts that we have out there. We mentioned the 5 CMOs. Are there other things that this would apply to? And what are other areas of, this is all in child and youth services, right? Oh, and by the way, the stuff from Assured Family Services, was that for people that were not in the juvenile detention facilities? Were these the services provided to youth that were not incarcerated?
Correct. That was abuse and neglect.
Yeah. Yeah. Okay. I think I would like at Health and Human Services for the department to present a little bit. This is complicated stuff here, and it had a lot of moving parts to make the commission and the public aware what the status is of these critical youth services, especially since they're in the community. And, you know, that's the whole idea, right? Just like with senior citizens, don't institutionalize them. That's the worst outcome you can have for seniors and for youth, is the institutionalization. So you keep them in the community, you keep them in their home and provide services there, which proves to be much more successful. And so if we've had this kind of major change where we're taking this stuff all in-house now, I would love to have that discussion and the Health and Human Services Committee be aware of what the structure is these days. So did I understand the Auditor General correct, that they're, despite the fact that Assured Family Services is no longer here, we are going to do a follow-up on
Correct.
this audit?
Correct. We're going to do a corrective action plan, request a corrective action plan, because like we said, I think the department agreed, these recommendations would apply to other contracts within the county. I mean, within the department.
Within the youth services.
Primarily the CMO contracts, I think the largest.
So I would suggest maybe for like a Health and Human Services visit, we wait for that corrective action plan, which will be applying more to all these other existing contracts that we have. And then we can discuss what the new system is by looking at the corrective action plan, right? And say how we are covering this in-house now. And I don't want to get into it here because it's a many, but we're taking on additional cost. Well, I don't know. And explain the cost, right? If the child care fund is, have we hired new people? Does the child care fund pay for that, or 25%? But you know, it's good to hear that the department agrees with the recommendations here, that these things need to be tightened up. And so I'll wait future questions for the corrective action plan, but thanks for let's go through the history here.
Marcy.
All right, Madam Chair.
I just wanted to commend the department, because I know we went through the the insurance certifications for that was actually the responsibility of risk management. The department does, even though it wasn't their responsibility, they are tracking their own insurance certificates, making sure annually the insurance certificates are provided. I want to commend them for that. And each month there's millions of dollars that come through the department that they're reviewing the invoice. And we're talking about 50 to 100 pages per contract, or at least for the Assured Family Services, that they're reviewing the invoices. So they should be commended the work that they are doing for those invoices and the review. And we just believe with these recommendations, just help tighten up their processes they have. But they do a really good job on what they're doing.
Great. Thank you.
Well, thank you. Thank you, Madam Chair.
All right. Can I get a motion to receive and file this item? Been moved by Commissioner Peterson. Is there support? supported by Commissioner Garza. All those in favor, please vote on your tablets.
My tablet's dead.
Oh, or just say aye. Aye.
Aye.
All right. Anyone opposed? Anyone wish to abstain?
We can go down and like
Motion
skipping stones down at the river.
Okay,
I
thank
see
you.
that.
Thank you for joining us today.
Thank
Thank
you.
you. Madam Clerk, next item.
F, such other matters as may be properly submitted before the committee.
I have none. Next item.
G, public comments.
Is there anyone here who wishes to make a public comment to the committee on audit? Second call for public comments. Third and final call. Hearing none. Next item.
Adjournment.
Is there a motion to adjourn?
Support.
It's been moved and supported. Without objection, we are adjourned. Thank you. Everyone.
I couldn't understand why nobody else.
There was a, it canceled, there was a contract came. And they said that there was only one proponent that